Do you think structure or function is more important when it comes to your mobility, your strength, or your ability to move? That's what we're going to dive into today in the Live Loud Life podcast. We're going to have a conversation about structure and function. Now, this is a spin-off of our last episode that basically talked about the 3 things I would never say to a patient that has lower back pain. So if you missed that episode, be sure to go back to that because there's a couple vital pieces of information that I want everyone to know about that are unfortunately very common practice in the field of lower back pain or spine pain management, right? So be sure to go back and check out that last episode. But today we're going to have a conversation about structure and function. Now, this is important because, as indicated in that last episode, one of the things that we would never say is that you need an x-ray or an MRI to determine what is wrong. Now, I will preface both of those tools, those diagnostic procedures are extremely valuable, but it comes with the time and place, right? There should be a series and a true honest to God effort of conservative management before we start going down that road. Now, there are certain instances in the base of trauma and other things like that where we would want to know those things, but unless indicated, that you should not do those things, right? Like if you were in a car accident and you have extreme back pain, we might want to know if there was a fracture. That would change the course of care, what we need to do. But outside of trauma, there is a reason why the pain developed, and that is important for you to know and understand. Now, that being said, structure and function. Structure does dictate function to a certain degree, and function can actually alter structure, as we see with movement, mobility, and stretching. We can actually change our physiology and our body, and we see this in a given example of this. To the extent of this can happen. Now, obviously, as we are older, we are less pliable, where those changes do not occur as frequently, or they do not occur as quickly. But when you look at I apologize. Youth athletes. I was trying to combine things at once, but baseball players in their youth, and especially pitchers, you actually see what we call a torsion of the arm because they're bringing their arm back to throw a baseball rep after rep, week after week, month after month, year after year. You will actually see the dominant arm of throwing start to torque. The bone actually starts to twist to allow them to get more layback, or what we would consider like the kind of cocked arm position back in order before they're able to release the ball. So we see how function influences structure. Now, what we see though is there are certain situations in which the structure, our own structure, could limit our function. Now, this might be, anatomical variations such as scoliosis and things like that. But we're really looking at, possible range of motion discrepancies and things like that. Maybe there's some abnormal bony growth due to severe, underlies emphasize severe degeneration that has created bone spurs, so on and so forth. But when we're looking at the majority of cases, this is not the case. The majority of us, our structure is solid, maybe weak, maybe deconditioned, right? And that is important, but it is healthy and it is good, right? So it oftentimes gets blamed because we want to use things such as imaging, x-rays, MRIs, ultrasound, and whatnot to determine when there's pain. We want to get a look under the inside. Oh, maybe something under the inside is not right, and that's why we're having issues, or that's why we're having pain. And again, as indicated, there are times and places where that might be true. But for the majority of us, we are not moving enough. We're not moving well. We're not strong enough. We don't have good mobility. We don't have good stability, right? And this over time takes precedence and kind of beats us up and breaks us down. So it's not that the structure is anything wrong. It's the behavior that influences the structure and the function that is a lacking capacity. That is the issue. It's not the structure's fault. as the saying goes in our field for many people, is it's not the load that breaks you down, it's the load that you're unprepared for. So oftentimes we blame the shoulder. Oh, you got a rotator cuff issue, you got a bicep tendon issue, and that structure is not healthy, or there's fraying or something like that, and that's what's causing your pain. While that might be true, there might be some fraying, there might be some irritation to that. It's not the structure's fault. It is the function of what we were asking it to do that then had negative consequences on the structure. So I want you to consider this and understand this, because this is important when you're looking at a recovery or a rehab program. And I am guilty to blame for this in a few of my injuries that I've had, is we half-ass it. We get back to what we assume, oh, I'm pain-free and I'm okay. But we don't actually address the underlying functional structure issue and the behaviors that are required for us to balance the equilibrium of what we need to be able to be and do to accomplish the task that we want. Now, if you don't want to do anything in life, well, that's fine, but you're going to slowly degrade, right? And then you will definitely see structural changes. So one thing to consider, right, is after the age of 40, you start losing 1% of muscle mass per year unless you do something about it. Now, this is a case in which our structure is changing, but again, we're not blaming the structure. It is the negative behavioral component of a lack of function then influencing structure, right? So the theme is change function, change behaviors for the positive, right? Making sure that you're moving well, you're drinking water, you're stretching, you're mobilizing, you're stabilizing, you're getting stronger, you're challenging yourself in different planes of motion, you're challenging yourself with new tasks, you're learning new tasks, you're learning new activities. All of those things from a functional, quote unquote, functional capacity will drastically influence, adapt, and change your structure for the better, right? Now, again, there are extenuating circumstances. We're just stating that because oftentimes people like to pick these things apart. Oh, but what about this? What about this? What about this? True. You could what if all day long, but the underlying notion is that you need to improve your function, and that in turn will improve your structure. A healthy frame, structure, your body, when looking at longevity, right? We want strong bones, we want strong muscles, we want strong ligaments, we want strong tendons and connective tissue, so that that will carry us on. Because what is living? The reason why movement is such a strong component of everything that we preach is you could live a long life, but if you can't move or do anything, what's that quality of life, right? The better able-bodied you are as you age and as you progress will only unlock more and more opportunities for you to enjoy all the other wonderful things of life. So think about that for a moment, right? Function over structure, right? Improve function, challenge yourself. Challenge yourself. If you want to live that loud life and do all those things, you have to take care of you have to take care of your structure, but through function, right? Now, if you need some guidance and some help, we'd love to help you out with that. We do remote coaching, we do remote consultation. Again, oftentimes we get in this whirlwind of not knowing and understanding, thinking it is a structural issues, and we're waiting and resting. We're sitting around, we're taking pain medications, we're taking steroids time and time again, and not understanding that we have to put that function first. Improve function. Start with where you can, and then slowly, brick by brick, start to build things up. And I promise you will start to see a positive change in the structure of how not only it operates from right, like how it moves, but also how you feel. Okay. So I hope that was super helpful for you guys. Again, we're trying to dispel a few myths here that most people are sharing. We want you to be proactive, because in order for you to live a loud life, in order for you to move well, you have to emphasize function over structure. So thanks for tuning in, guys. Till next time, live loud.